Mr. Jitters and his issues, yeah. Next. Good afternoon.
Hey, doctor.
Mr. Jitters. That is an unhealthy lunch and definitely not drinking. Give this to me. Throw out that chicken. Have you been taking your medicine lately?
Yes.
Is it working? So you're still feeling a lot of pain in your heart right now?
Yeah.
Okay, you're going to need a heart transplant.
Dr. Lamb.
Okay, one moment. Read over this. You have two choices. Take a heart transplant or don't. It's a little risky, but it'll be good for you. I'll be right back.
A 1, 2. How do I start? Oh, what is that? Should I do it?
Yeah, yeah. Don't you think this is going against all morals and ethics? The donor is brain dead. They're not completely dead. They need their heart for their afterlife. But that's considered already dead. There's no brain activity. And how is that unethical? The donor chose to donate their heart. It's for a good reason. So don't you feel like someone else is in you? Aside from morals, do you think about the risks though? There's so many side effects that might happen after surgery. From anti-rejection medications, you can get problems with breathing from anesthesia, internal bleeding, infection, blood clots, severe coronary artery disease, high cholesterol levels, diabetes, bone thinning, and rejection. If you encounter any of those problems anyway, there's medications to help that too. But if you don't take the transplant, you're gonna die. In addition to post-operation, you're going to have a tied-up life. You have 6 months of recovery. Before that, you're gonna have to stay in the hospital for at least 1 month. Then after, you can have regular checkups to make sure your heart isn't facing too much rejection and new medication might need to be prescribed. In these, you're going to be facing a lot of x-rays, blood tests, echocardiograms. Then you're going to have to take a lot of drugs to make sure your immune system is suppressed. And you're going to have to get a cardiac catheterization every year. Also, what if you have an emergency? There might be another heart failure. You already spent so much time with pre-operation. Don't give up halfway. It might not even be successful. There's a 20% chance that it might not work. Wouldn't you rather spend the last few months of your life doing things that matter to you? Look on the bright side. More than 80% of patients survive at least 2 years after the transplant. Then for 5 years, it's 70%. If rejection is controlled, you can live for more than 10 years. While your old heart is out, the doctors will hook you up to a heart-lung bypass machine. This machine will help supply oxygen for your blood while you don't have a real heart.
What if I don't get a donor?
You don't need a human heart. Technology is so advanced these days, you can get a genetically modified pig heart. In fact, body is actually less likely to reject the pig heart than another donor's heart.
Oh, my uncle had a heart transplant. What did he say? Why did you need a heart transplant?
I was having a heart attack. My wife said my face turned blue, didn't have any pulse.
The doctor said my heart was completely damaged, not functioning anymore. My wife insisted, why don't you put the artificial heart?
What did the doctor ask you when you got to the hospital?
And they've been asking me a lot of questions about his medical history, my family, and our income. And
What was the process of the entire transplant?
Well, the only criteria is the blood type. If it's the same, they can transplant you.
the operation lasts about 5 hours, and then the surgeon coming back to tell me the operation was very successful, and because the donor was perfect fit. After the operation, they sent him to the ICU, but in the ICU after 1 hour, and they found out his blood pressure was dropped down to very low. He got the breathing. Those days to send him back to the operation room to do some kind of prepare.
Did your personality change after the operation?
No, not really.
What are some of the side effects after the operation?
After 2 or 3 days, he can't talk or walk, and they had to send this speech therapy and the physiotherapy.
After the surgery, how often did you have to visit the hospital?
Well, after the transplant, I stayed in the hospital for almost a month. And I came home.
Just for this small thing. Sometimes the blood pressure was dropped down, and sometimes the pulse was fast.
And after 6 months, I think the condition remained stable. I had to go to the hospital every 3 months. To go to the hospital, in 3 months' time, they do the biopsy. That means they took some tissue out from the heart to check whether there's any sign of rejection. Biopsy was done almost 3 or 4 years after. Right now, I don't have to do it.
Mr. Jitters!
Yeah.
Come, follow me to my office. Wake up.
Oh.
So, did you understand what I gave you in the sheet?
I guess, yeah.
Okay. So what are some specific questions you still have about the heart transplant?
Could you explain the donor process more?
So, donor is going to be from someone who is brain dead, and they've agreed to donate their organ, and in this case, a heart to you. The chances of you getting this is probably higher considering you're still young. Most people 70 or 80.
So the odds are very good for that.
Yeah, do you have any other questions?
Yes, on page 7, there's this word, cardiomyopathy? Yeah.
Okay, there's 3 types, and that's a disease of the heart muscle, which is often weakened. And 2 types which are often inherited. The one you have, however, is often caused by alcohol abuse. After, if you get the transplant, you can't drink alcohol, and therefore you're changing your lifestyle. Or the heart transplant will be useless. The causes might be like if they had a previous heart attack, heart valve issues like stenosis or regurgitation, or a congenital heart disease. Anything else?
Could you explain the surgery process a little more?
There's 3 basic steps. First, they harvest out the heart of your donor, and after they take out the heart, it lasts a maximum of 6 hours in ice. So the second step is taking your diseased heart out so they can replace it with a new heart. The process of taking out your heart depends for many people. Since you didn't ever have a heart surgery before, it should be simple. For the last step, you put in the new heart, and 5 lines of stitches are made, which is called anastomosis. This connects your blood vessels that are entering your heart, such as veins, and the blood vessels leaving your heart, like arteries. You can take immunosuppressive drugs, which helps your immune system accept the new organ, and also biopsies are used to monitor this. Other medications that go with your immunosuppressive drugs might include some of these on the list, which are for strengthening the bone, blood pressure, infections. You can take a look.
Wait a minute. My uncle has a sheet very similar to this.
Frank Jitters?
Yeah.
Wow, such a small world.
You know what? I'm gonna do this heart surgery.